welcome you to the importance of vaccines, this virtual town hall meeting, building trust within communities of color. YWCA Tri-County area is really happy to be part of this event. The mission of the YW is to eliminate racism, empower women, and promote peace, justice, freedom, and dignity for all. And there isn't anything more dignified than education, and we hope that you will find this town hall meeting really educational as you move to make decisions about whether to vaccinate yourselves going forward. We have a few housekeeping items to get through before we get started. Please use the chat to submit the questions to the panelists. A recording of this event will be made available afterwards, and the recording will be emailed to all town hall participants. You can send the chat to Holly Parker for assistance with any event technology. And you can visit the pottstownfoundation.org/events/town hall for COVID-19, flu, and other vaccine information resources. And keep on the lookout for our message after the town hall, which will include a link to a post-event survey, I apologize. So we hope to see you at our future town hall events. An alternate live stream is available at facebook.com/Tri-County Community Network.
Real.
So participants are currently in a presenter view mode. Please click the gallery view at the top right corner of your Zoom screen if you would like to change your personal view mode. That way you'll be able to see the slides and the people speaking. So welcome. I'm going to turn the event over to John Harris, our moderator for this evening.
Thank you very much, Stacy. Welcome, everybody. Very happy to have you here. I'm John Harris. I'm a director with Verilon. We're a healthcare management consulting firm, and we have worked with the Tri-County Health Council for 7 years now, and very excited to be supporting this event. This is the agenda for today. We'll do introductions of our panelists, and then we will get into questions. I'll ask a series of questions to our terrific and very thoughtful panel, and then we will answer those questions, and then go to a number of questions that were sent in by many of you in advance, as well as questions that you can send in now in the chat that we will try to get to before the end of the hour with everybody. So that's the plan for today. Let me start by, well, let's do the introductions and then I'll make a couple of comments. So Dr. Lorraine, would you introduce yourself first, please? You're on mute still.
There we go. I had to click a couple times to do that. I apologize. Good evening. Thank you very much for inviting me to be here, and thank you all for joining this very, very important event. I'm Richard Lorraine. I'm the medical director of the Montgomery County Office of Public Health. I'm an internist, and I've been in private practice in Montgomery County for 35 years. Took the position with the county approximately 4 years ago. Of course, not expecting everything that would be happening going on right now. Very pleased to be with you this evening, and I hope to be able to answer questions in that particular area.
Thank you very much. And Irene Shepard.
Hello, everyone. I'm Irene Shepard. I'm the Chief Medical Officer at Community Health and Dental Care in Pottstown. Community Health and Dental Care is a federally qualified health center that has been serving the residents of the Tri-County area since 2008 for their healthcare needs.
Thank you very much. And Johnny Corson, Mr. Johnny Corson.
Hello, my name is Johnny Corson. I'm president of the local chapter of Pottstown NAACP. Our mission is to secure the political, educational, social, and economic equality of rights in order to eliminate race-based discrimination and ensure the health and well-being of all persons.
Thank you, Mr. Corson. And Megan Smith.
Hi, everyone. My name is Megan. I am the Health Planning and Promotion Coordinator at the Chester County Health Department. I joined the team just a few months before COVID really hit us in earnest, so it's been quite a learning experience, but I've been working on the COVID response since the beginning, focusing on community engagement and communications, and in that same role with our vaccine response as well.
Thank you very much. And Commissioner Arkush.
Good evening, everyone. I'm Val Arkush. I am Chair of the Montgomery County Board of Commissioners, also a physician by training, and have a degree in public health. So this has been a really interesting time for me, bringing really all of my skill sets together to fight this pandemic on behalf of the 830,000 people that live here in Montgomery County, and excited to share some of that with all of you tonight. It's a pleasure to be here.
Thank you very much for joining us. And Nelly Jimenez.
Buenas tardes. My name is Nelly Jimenez, and I am the Executive Director and CEO of Aclamo. We are the only full-service social services organization for Latino and other minorities in Montgomery County. Thank you.
Thank you very much. Just by way of introduction and the reason that this event is happening, the coronavirus, COVID-19, has harmed communities of color more than other groups. This health disparity is leading to more illness and more death in communities in color than in other communities. The Tri-County Health Council and the Montgomery County Immunization Coalition decided that it would be important to address this health disparity and provide information to the community. So we've gathered together this outstanding panel representing a broad range of perspectives, including community leaders, health experts, public health experts, and our goal is to provide clear information. We want to discuss some of the history of and reasons for mistrust of the health system among communities of color and how that affects decisions about the vaccine. And importantly, we want to answer your questions that you have so you get the information you need to be able to make good decisions about getting vaccinated. So I'm going to jump right in. I'm going to ask a lot of questions and I've already asked the panelists to provide very succinct answers to the questions so that we can cover a lot of ground. So let me start, and Dr. Lorraine, this one will be to you. We've all heard about hospitals filling up around the country. As a physician treating patients, how serious is the risk of illness and death from COVID-19? Is it just like the flu? And if it is, why are the hospitals filling up the way they are?
So let me start off by saying that succinct is not my style, but I will do my best. So COVID-19 is a viral disorder, but it's not quite the same as flu. Everyone does kind of keep it as a somewhat analogous situation, but there are definite differences with it. COVID-19 is a much more transmissible illness than the flu is. It's much easier to catch. And that's part of our problem. That's why the absolute numbers are so much higher than they are with flu. The spectrum of the illness can be very, very variable. There are some people who will catch the virus. They'll not even know that they have it. They will have no symptoms whatsoever. There are some who will be mildly ill and basically have what we would consider to be a cold. Others will be somewhat more ill and will have something analogous to flu symptoms in that they will have a fever, severe myalgias, fatigue, and similar type symptoms. And then the spectrum increases even further because this is an inflammatory disease. So we do see a lot of inflammation in the lungs, leading to shortness of breath in the more seriously ill people. Those are the ones that we really worry about. They end up getting hospitalized, and some of them become so ill that they do need to go on a ventilator for assisted breathing. The death rates are not terribly high in the younger population. The death rates for very, very young people can be significantly less than 1%. But once the age starts increasing, the death rates go up considerably. So while you may have, for example, 0.4% in the age range of around 55, once you get up to 85, the mortality rates can be as high as 15%. The real issue with this is not so much the actual fatality rates, but the fact that there are so many cases. If you multiply the number of cases by the fatality rate, you'll get a very large absolute number. So that's why we're seeing so many people getting very sick, being admitted to the hospitals, and taxing the ability of the hospitals to keep up with that. It's basically a numbers function. And the illness can be very, very severe, and it is hard to treat, taking a lot of resources.
Thank you. Thank you. And just one follow-up question to that. For patients where they do get a serious case, can you describe some of the challenges for your patients who are hospitalized, and also perhaps about whether we know about long-term effects from COVID, even for those who recover?
The main issue that gets people hospitalized is the lung inflammation, which will lead to very significant difficulty in getting enough oxygen into the blood. One of the ways that we can discriminate, we do have a lot of people using pulse oximeters, which are little machines that you clip on your finger, can tell you the percentage of oxygen in your blood. These are actually available in the pharmacies and are not terribly expensive. When that oxygen level is normal, it should be somewhere in the neighborhood of 96, 98% saturation. When someone has this COVID infection and the lungs are getting inflamed, it's very easy to see that oxygen level drop to the low 90s and even below into the 80s. If it gets down to that point, they need hospitalization because this progresses very, very quickly. So it's usually the respiratory problem that gets them hospitalized. A significant percentage of them, because of that inflammation in the lungs, will need assisted ventilation until we can get that inflammation under control. This is something that probably will lead to some long-term issues as well, in that there are people whose oxygen levels don't go back up to normal even after they are in the convalescent stage. When they've been discharged, they're at home, they still remain with low oxygen. Sometimes they have to stay on supplemental oxygen. And this may persist for some degree of time after that hospitalization. There's problems also that we see with coagulation, with clotting of the blood. And blood clots are occurring very frequently with this. And obviously, if you block a blood vessel, that's going to create problems with the area of the blood supply. And that can even be in the brain as well. So there are a lot of potential long-term effects of COVID-19 that we are going to be looking at in the future. And my screen is frozen.
I think we're coming back. Let's see. Mine's still working, but did we lose anyone? We all still here?
No, I think it's John's.
We may have lost our moderator. Yeah.
Okay, that's all right. I think I was next. So I'm happy to kind of jump in off of what Richard is talking about. So if we're talking about some of these concerns about what happens when you have COVID, what are we concerned about? How serious is it? But we can talk a little bit about what we can do to avoid that. So we know there's a vaccine right now. That's one of the key topics we're talking about today. But we also know it's not being rolled out to everyone right now. What are some of the things that we can do before everyone has access to the vaccine? Because it's also important to remember the vaccine is not the cure for COVID. It's a tool. It's one of the tools in our toolbox. There's a couple of things we can do before then. So I know everyone is tired of hearing wear your mask, wash your hands, keep distance, but they are still really key for keeping people safe. Even if you're tired of it, even if it bugs your face, we got to keep doing it until we can get more people vaccinated and really get this a little bit more under control. One of the other things we talk about here at the health department is how do we empower people to have really tough conversations with their family members and friends, to feel empowered to say, hey, I don't feel comfortable coming to this, I'm concerned, or don't feel comfortable with you coming over to my house, you haven't been social distancing, I know you haven't wearing a mask. These are really tough conversations, and a lot of people here, we talked about having tough conversations with our families around the holidays. So being assertive, knowing what you know and using the information you have, being assertive about keeping yourself and your family, your community safe. That may mean not going to gatherings, not spending as much time, shopping around Target, going in and out for what you need, really limiting your exposure. As tough as those things are, we want people to feel empowered to be flexible, make change in plans, be assertive when you don't feel safe, and also just do your best to have tough conversations and try to keep your family and your community safe as well.
Thank you, Megan, both for your answer and for jumping in there when I disappeared. But my connection is back, so thank you for that very valuable information. So hand washing, masks, maintaining that distance, doing all of those things to avoid getting sick still are key tools to pursue. Thank you very much. So let's shift gears. This was a very helpful basic background about the vaccine. Again, if you have questions that you want to, I'm sorry, about the illness, about COVID, if you have questions you want to ask about that, please enter them into the chat. We're going to shift gears and start talking about the vaccine itself. And the big question I think that everybody asks when there's a vaccine is it safe and does it work? So Irene, would you, Irene Shepard from Community Health and Dental Care, would you address that for us, please?
Sure, John. So currently, there are 2 vaccines that have received emergency use authorization from the FDA, and those are the Pfizer vaccine and the Moderna vaccine. Both of those vaccines were tested in tens of thousands of adults from diverse backgrounds, including older adults and communities of color. In fact, the Pfizer vaccine was tested at over 43,000 participants and the Moderna in 30,000 participants. And through those trials, it was shown that both of the vaccines are very safe and effective. Both vaccines have about a 95% efficacy rate, which means that they prevent disease 95% of the time, which is an incredible efficacy rate. They also showed in that other 5% that they did protect against serious illness. During the trials, there were really no serious issues that were shown during the trial, and both vaccines have been held to the same safety standards as all vaccines that we have seen prior. One of the things that is a little different about this vaccine is it works with a different type of technology than we're used to seeing, which means, and that technology uses what we call messenger RNA. And this is a different technology, but not necessarily a totally new technology. In fact, it's been being studied for about 30 years. This kind of vaccine, actually, when it's injected, allows our cells to make a little protein spike that you see with the COVID virus. It doesn't give you the virus. It's not a live virus vaccine. After that protein is made, the cell breaks it down. But that protein allows our body to recognize it and build antibodies or build up an immunity if we're exposed to the COVID virus. So again, it's a different technology, but it's not a live virus. It can't give you COVID-19, and it cannot affect your DNA or your cells in any way.
Thank you very much. So the vaccine, first of all, in terms of its effectiveness, I think I heard you say that it is 95% effective in keeping you from getting COVID and 100% effective in keeping you from getting seriously ill from COVID. So that last 5% even are helped and prevented from getting seriously ill.
Preventing serious illness, correct.
And the original threshold that I think was set for a vaccine was that it would be some 50 or 60% effective in order to be accepted.
Absolutely. I don't think anyone expected this effectiveness of the vaccine. For me, it's very exciting and reassuring that it's as effective as it is.
Terrific. Thank you. So let's talk about what happens when people get the vaccine. They actually, go and get the shot, and there are two separate shots for this, initial one, and then several weeks later, a booster shot. And so many of us have probably heard that for a small number of people, they might have side effects like getting the chills or feeling like they have a little bit of a flu or their shoulder is sore. are these side effects something to worry about? Does that mean we're getting sick actually? What does that mean? Again, Irene Shepherd, if you would answer that for us.
Sure. So some of the side effects that we do see with this vaccine can be fever, body aches, headache, just feeling kind of down, which is what you can see with any vaccine. And what this means, it's actually a good thing. It means your body's responding and building an immune response. So that this is a sign that your immune system in your body is actually working well and you're building immunity to the virus.
Okay.
Dr. Lorraine, please.
So one point I wanted to add to this is, I think, very, very important and germane to the topic tonight. When people get a vaccine, sometimes when there are concerns about it, one of the questions we often hear is, am I going to get the disease from this vaccine? And especially because of those symptoms, the fever and the aches and the other thing, that's the concern that people raise. And we need to be absolutely clear that with these vaccines, there is zero possibility of getting the disease from the vaccine. Irene explained how the vaccine works. There's no active component of the virus in this vaccine. It is impossible to get the disease from the vaccine.
Thank you very much, Dr. Lorraine. Commissioner Arkush, I was wondering if you could help us to understand some of the timing about when the vaccine will be available and to whom and how that's all being planned out.
Yeah. So vaccine is just starting to become available. Right now, there are 2 vaccines that have been approved through the Food and Drug Administration for what's called emergency use authorization. They're from 2 different companies. And right now, those vaccines are being used in 2 main groups. One is people who work in hospitals, and then the other are people that provide healthcare in other settings. So doctors in private practice offices, dentists, home healthcare aides, physical therapists, people like that, as well as our paramedics and EMTs. So they're called the 1A group. You may have heard some reference to this. Because we only have these 2 vaccines available, and it's only been a few weeks since they've been approved, we don't have enough doses for everybody at this point. So for these first early weeks, it's the individuals that take care of people who have COVID that are getting vaccinated first. We hope here in Montgomery County to be able to move to the next group, which is known as 1B, by the end of the month or the beginning of February. And if you live or work in Montgomery County, we can give you a website to go to where you can pre-register to sign up to get a vaccine if you're in the 1B or the 1C category. In general, if you're 65 years of age or older, or have one of about 7 or 8 current medical conditions, you'll qualify to either be in that 1B or that 1C group. And then there's also a number of professions that will qualify to be in 1B and 1C. And they include police and firefighters, teachers, people that work at grocery stores. There's just a very large group of people that are working in transportation, run our public transportation systems, folks that are really out there in the front line interacting with the public in their jobs. These are the easy way to think about it is these are people that really can't work from home. And so we are anxious to get to that group and start vaccinating them. And hopefully by the end of the month or the beginning of February, we'll be able to do that.
Thank you very much. And we all look forward to that expanded availability. In case folks aren't kind of following the national news on this, the reason we can't just vaccinate everyone right now is that it's taking time to actually manufacture the vaccine. And so these priorities have been set so that the people who need the vaccine most get it first, and starting with our healthcare workers. So thank you very much, Commissioner Arkush. Let's shift gears now to one of the key themes of our discussion tonight, which is concerns of communities of color regarding the vaccine. And part of the context for this that's important to understand is some of the history of the health system, the medical establishment's treatment of minority communities. And one example of that you may hear reference to is the Tuskegee syphilis study, which was a study that started in 1932 and included 600 Black men in Alabama, 400 of whom had syphilis and 200 did not, but were part of the control group in the study. And that study involved those people either getting treatment or not treatment over a period of time. And that study extended all the way to 1972. So for 40 years, the participants in the study were unwittingly, many of them unwittingly, getting no treatment for their condition. So that led to a fair bit of re-examination of the process for doing studies and led to a real transformation of that and improvement in medical studies. But it also left a lot of mistrust, that and other situations left mistrust in the Black community and other communities of color. So with that context, I guess I'd like to start by asking you, Mr. Johnny Corson, what questions do you hear from the Black community regarding vaccines? What are you hearing now? And I need you to unmute your line there.
Thank you for hear me.
Yes, we hear you.
Okay, to piggyback off of what you said earlier, just take it a little bit back historically. Black enslaved men and women were used for medical research. So it goes further back than what you were talking about with the issue you brought up earlier. But what I'm hearing in our community is that among the older crowd is that there's fear and there's a lot of doubt of taking the shot and of being forced to take it because of the older community, Black community, with the underlying health issues. Now, the younger Black community, they're more afraid of being used as experiments, and there's not enough info coming out to justify them taking the shot. Now, our national office has been on top of this, so there's a couple of statistics I want to run past before my minute's up from the national office. Right now, fewer than half of Black people said they would agree to take it. 14% of Black people trust that the shot will be safe, and 18% of them believe that if they do take it, it won't shield them from the virus. 49% of African Americans will not take it, even if scientists deem it safe. 55% of Black people say they know someone diagnosed with the COVID-19, and 48% know someone who has been hospitalized. So with the statistics and what the national office is hearing and what you're hearing on a local level and the historical,
we just, the last couple of sentences of what you said we lost there. Do we have your audio back? You want to try say something again?
yeah, my internet just got lost. Do we need to?
Okay,
I need to go over.
You're back. You're back. We hear you.
What part did I get lost at?
Just the last few sentences of what the national office had said.
Well, briefly, the national office said that half of Black people said they would take the shot. 14% of Black people do not trust it, and other ones, and 18% of Black people feel that if they did take it, it wouldn't affect them. Did you get that part?
Yes.
And 55% of Black people say they know someone who has been diagnosed with the COVID-19, and 48% know someone who has been hospitalized with it. So that, combined with the historical aspect of Black people being enslaved Black people being used as experiments, the older Black community members are afraid to take it, but they feel like they have to be forced to take it because of the underlying health issues. The younger Black population, they feel that if they do take it, they're just being used as experiments, and there's not enough info for them to take it. So even if they did take it, they don't believe it's going to work either.
Right, right. Okay, well, thank you. We'll come back with some follow-up questions about how to address those concerns, what information would be needed, what would be helpful to the community to be able to make decisions for themselves about what to do. Let's open the question as well to Nelly Jimenez. What questions do you hear in your role with Aclamo from the Latino community regarding the vaccines?
So to talk about the Latinos and the COVID-19 vaccine, I think we have to make sure that people understand that Latinos are not homogeneous, that we have, depending on what community you're working with, you're going to find difference on opinions and also of experiences. So we have not all Latinos are immigrants and not all immigrants are Latinos. And I think that's a big, that we have to take in consideration that, because if you have been in United States, if the border crossed you and you're being in United States for generations, you may have been part of the experience that Black American had, like, affected by the historic racism in healthcare. But if you are a new immigrant like me, or my children that are first generation, that may be a different experience. So I think that's important to highlight. A couple of the things, of course, a lot of our community are reluctant. We find that only 34% of Latinos are feeling okay with the vaccine. The other percentage are not feeling either comfortable that they're going to wanna get the vaccine, or they still have doubts. A lot of people we have heard that say, well, other people can go first and then we go later, right? So there is a lot of reluctancy about the vaccine. There are a couple of things. Safety, right? They want to know how safe the vaccine is, so they have doubts. They have doubts about if the vaccine has been tested on other Latinos. Are they going to track us? What happens if I go and I provide my information? It's going to cost us money. What kind of documents they're going to ask? If I go to my second doses to get my second doses, is immigration going to be waiting for me, right? So there are a lot of issues about safety. The other thing is how efficient or how efficacy the vaccine is. There is a lot of mistruths. They're trying to balance or measure how efficient, what are the risks, and whether if the benefits, will be better if they get the vaccine. We also have a lot of lack of trust and past trauma, so that's part of it. And then lack of understanding and mixed information from different venues.
Thank you. Yeah, so understanding a diversity of perspectives folks are coming into this kind of decision with, certainly appreciate that and recognize that. Let me ask you, Stacy Woodland, at the YWCA, you're interacting with individuals of all different backgrounds. What are you hearing in particular from communities of color regarding this in the Pottstown area?
So what I hear primarily is a really disparate amount of information. Families and people that I know that have trusted relationships with healthcare professionals are much more likely to say, yes, I'm going to get the vaccine. When there are families who I know that use the emergency room and don't have trusted relationships with healthcare professionals, they are less likely to trust that the healthcare system is going to take good care of them. And so I think these are important conversations to have in our community to help build trust, to have doctors come into our community and talk about how all these things happen, but to also have, community health and dental and other organizations that make healthcare accessible to everyone, and that they are focused on building relationships with individuals and not just kind of funneling them through. So I think that's what I've heard from, people that I know, people that are connected to healthcare. Many people in the Pottstown area know and love someone who was very negatively affected by the coronavirus and still have hesitation in saying that they are going to take the vaccine.
Thank you. Given those challenges in terms of trust, we have a number of healthcare professionals participating in listening to this session tonight. What would you advise them in terms of communicating with and connecting with their patients who may be members of communities of color so that they can effectively help them make good decisions about the vaccine? And that's to you, Stacy, or you, Johnny, or you, Nellie.
So I think it's critical to have cultural competency when you're talking to people that are of a different culture than you, so that you're able to address and assess fears, both stated and unspoken. And so I think it's important to be able to understand all of the baggage that a community of color brings and mistrust to situations like this, and be able to address it personally with knowing that this could be a fear of yours. And let me explain how this isn't going to be a significant issue, because I loved the way that Irene and Dr. Lorraine both explained. I will say, I thought there were a lot of SAT words, and that a lot of times when we're talking that we need to make sure that people understand. It doesn't have anything to do with your level of education, but it does have a lot to do with how familiar you are with that specific jargon, and making sure that you're understanding what the professional is saying to you about you. So I think those are ways to make sure that we are making the message clear to everyone.
Thank you.
So for me, first of all, I think it has to start, we're talking about lack of trust, right? So I think for a lot of Black and Latino, the acknowledgement of harm done in the past is going to be key to start, developing that relationship. So for me, the message is important, but it's also the acknowledgement that people are lacking trust, right? And how do we build that? But also the message is important, but for me, the most important thing is the messenger. Who is a trust local community Latino leader that is out there with the community that people can follow and can trust that they're going to be looking for the best interest in the community. And it's important, of course, to have bilingual and bicultural, but it also have to be sensitive, and it has to be low literacy, and the translation have to make sense. It has to talk to people in the language that they understand. So it's not only a translation in Spanish, it's how do you culturally get to people to understand the message. So it's not only translation. A lot of people ask me, why do you don't request things in Spanish? Because I can understand the translation in English, right? So I think it's not only word by word, but what the message is. And of course, we have to make sure that we understand that, yes, a lot of our community members may want to receive their message in Spanish, but we also have a lot of Latinos that are not Spanish speakers. So how do we include our people from Brazil that speak Portuguese, right? But are also Latinos. So we have to be a little bit more mindful. We have to know with our target area, our target audience, where they live. And that's one of the issues that it always irritates me when we talk about data, right? That's one of the biggest barriers for Latinos, because we don't have data that can show us where to go, how to track people, and where the people are coming from, so we can better tailor the programs to them.
Yeah, thank you very much. And Johnny Corson, yes, please.
Am I unmute me? Okay. First, I have to say this, that in the Black community, we're twice as likely to trust a messenger from our own racial group compared with a white counterpart. Like somebody from the Black COVID-19 doctors, bring in more Black experts so we can have the conversation with those Black experts. And when the COVID rolled out, even though it was affecting the Black and brown community so much, it seems like the test centers were set up in predominantly white areas and conversations were limited, but did not exist to get them into the Black and brown areas. For example, here in Monco, the first test center was set up in Bluebell. It wasn't set up in Pottstown, or I don't believe it was set up deep in the heart of Norristown. So Black and brown people were expected to travel all the way to Bluebell, even though the COVID was affecting the Black and brown community more so than I believe in Bluebell. But
I think we lost your audio again. So we'll give it a second. We can come back to you. Not yet.
all right, I don't know what part
Now
did
we
you
got
hear?
you. You just
Okay.
said it was about traveling to Bluebell. That was the concern.
Yes, which
Yep.
leads me to the challenge here with the Black and brown community is overcoming mistrust and earning trust. And to earn the trust of our communities is going to take transparency, honesty, respect, and it's going to take time. And we need to bring trusted voices into the community, not just experts in the health field, but we have family members, we have friends, we have barbers. You'd be surprised how influential barbers and hairstylists are in our community. Medical providers, so I brought that up earlier, but local radio hosts and NAACP leaders, preachers, pastors, both the message and the messenger matter.
Thank you. Appreciate those points, and thank you all for bringing that perspective. We're going to shift to some of the questions that you all, the audience, asked in advance of the session and then also during the session. One of them has to do with people's specific medical conditions. If people are pregnant or if they have a compromised immune system, there are questions about whether it's safe to get the vaccine in those circumstances. And without asking you to provide medical advice on a fictional patient, Dr. Lorraine or Irene Shepard, if one of you would like to weigh in on that.
Sure, John. Well, I'll talk about the issues with pregnant women or women who are nursing. So the bottom line with that is that we really don't have enough information to know if the vaccine is safe for pregnant women or breastfeeding women because it hasn't been tested in those groups. So does it mean that they can't get the vaccine? It just means that we don't know. And that's a common thing that we see with medications, you know, with other vaccines. People are just less likely for legal issues and other things like that to want to test in those groups of people. So I know that there have been pregnant women and breastfeeding women who have received the vaccine and have been fine. Again, we don't have the data. So what I would recommend, the best thing to do is, if you are pregnant, to talk to your OBGYN provider who knows your medical history, knows what other concerns you may have as far as if you have other health issues, and help you make the best decision about whether the vaccine would be good for you to receive or not.
Thank you very much. Dr. Lorraine, anything to add on that?
I do. So coming at this from sort of the opposite perspective, there are medical conditions that put people at higher risk for developing severe disease. In addition to advancing age, of course, we have a list of several things which are clearly associated with increased risk, one of which, by the way, is pregnancy. We have other things like diabetes and emphysema, sickle cell disease, obesity, and severe obesity definitely puts people at increased risk. Smoking puts people at risk as well. So these are people who are actually going to be prioritized into our earlier vaccine administration because they are at higher risk for developing severe disease. One of the other issues that we have that relates to people with underlying conditions is how well is the vaccine going to work? particularly in people who might be taking medications that affect the immune system. And we see this a lot. So we have people who have cancer, who are on various types of chemotherapy. There's other types of immune type therapies that are used now in many, many conditions, gastrointestinal disorders, skin disorders, neurologic disorders. All of these use medications that affect the immune system. And one we've been finding is that use of these medications will decrease the efficacy of the vaccine. To what degree, we're not really sure. So there are some of these people are timing their vaccination with their medication so that they can perhaps be off those medications at the time they get the vaccine for it to have its greatest effect. And that gets very complicated as well.
So if you have either a condition that compromises your immune system or are getting a treatment that compromises your immune system, you should talk to your doctor about getting vaccine or find a doctor who can help you with that.
Absolutely.
Thank you. Okay, great. So there's a question that came up. How do we know that the vaccines will work for people of color? Who wants to tackle that? Taking volunteers from the panel now. We're into the new questions. Anyone want to?
I could talk a little bit about that. I actually asked Dr. Paul Offit that very question. Dr. Offit is a pediatrician who is on the faculty at CHOP, the Children's Hospital of Philadelphia, but he also happens to sit on the FDA panel that reviews vaccines trials for approval. And he told me that in the clinical trials that have been done with the 2 vaccines that are approved, the composition of the group that was studied in those phase 3 trials, which were in the 30,000 person range, the percentage of people, and I don't remember exactly what it was off the top of my head, but the, excuse me, the percentage of people of color that were in those clinical trials reflected the percentage of people in our population. So I don't know what the exact number was, but there were a fairly decent number of individuals who were African American or Black that were part of those clinical trials.
Dr. Arkush, that was about 12%, which again kind of represents the makeup of the general population.
Yeah, thank you. And that certainly is almost exactly what it is here in Montgomery County. We have about 10.5 or 11% of individuals who identify as African American or Black.
Thank you. And importantly, the results for that subgroup of the study population, of the population that the vaccine was tested on, the results for the Black group and the Latino group in there were the same. It was as effective for those participants in the study as for the study overall, is my understanding of that.
That is correct. And also on the flip side, there was no difference in any kind of side effects in those groups.
Right. So there's another question here that people are concerned about the long-term effects of such a vaccine. And I guess there are always medical, sort of judgments going on when you're thinking about the long-term effects of the vaccine. There are also the long-term effects of the illness, if one gets the illness. Who would like to speak to that question of long-term effects and the relative risk?
At the risk of sounding rather simplistic, we won't know the long-term effects until we see the long-term. One of the limitations of studies like this or development like this, and this has been particularly telescoped into a relatively short period of time, is that we don't really have that information and we will be getting it over time. There are ways to project it. There are laboratory methods that can be used to try to simulate whether or not we will see any significant long-term effects. And of course, there hasn't been anything really identified that we're concerned with at this point. But that's something that's going to have to be seen as this rolls out over the long term. One general point that relates to this, the decision to use a vaccine, the decision to use a medication, the decision to have surgery, any of these things is subject to something that we call risk-benefit ratio. So we're always going to look at a situation where we have a condition and we have a treatment for it. We look at the risk of the treatment, we look at the benefit of the treatment and try to balance that. So we're making the recommendation, for example, for this vaccine, because even with the small unknown of the long-term effect, we feel the benefit far outweighs the potential, the small potential for that negative long-term effect.
Thank you. So I will ask Dr. Lorraine, Commissioner Arkush, with your physician's hat on, and Irene Shepherd, I want to ask you all as clinicians the question that I always think is the most important question to ask a clinician. If it were your mom, if it were your son, if it were your spouse, would you tell them to get the vaccine?
Absolutely.
In a heartbeat.
100% I would recommend it. And I myself received my first dose last week.
I agree completely.
Okay. So I think that's important to hear. It's very, there are a lot of complexities with all of these points and the subtleties of the questions that are being asked. But that basic, what would you do for your own family member, I think is important for us to all hear. And sort of the critical question. Let me ask Holly, I believe that Holly Parker, TCN, I believe that you've been getting some questions through the chat. Is that true? And do you have any questions from participants?
Yes, I do have a few questions. The first question is, what support can we offer to communities of color that are disproportionately impacted by COVID and may not have access to PPE or the ability to work from home?
Who would like to speak to that?
So I just want to mention, again, I'm going to go with the messenger, right? And I think part of it is because for me, a lot of the decisions that are being made by people that are not people of color. So how do we integrate the feedback of the people of color into tables where decisions are made that are affecting people of color. So that for me is one of the pieces. I think also, no minimizing that communities have a lack of trust, and it is important for us that we deliver a sensitive and culturally sensitive message to our communities using different platforms, not only social media. Many times people say, well, there are so many social media venues, but you have to really get to know the local people that are doing grassroots messaging. So like in my case, like I follow every single Latinos in Montgomery County, Latinos in Norristown, Latinos in Pottstown, Latinos and me and Latinos, right? Like, because that's where people are, that's where the messages are. And I think that we need to think about the diversity of people and how they're receiving messages. And I think that we have to have different platforms. And also, one of the things when you guys were talking, I thought about it, that it have come up a lot is, well, they cut corners to get to where we are, right? And I think we need to understand that we cut red tape, but we didn't cut corners in science to get the vaccines that are right now being used with people. And I think that's part of the messaging of the trust. I think you have to work in partnership. Like in Aclamo, we try to work, and I know Sharon is there with, and George with the Korean American Association, right? So that we can become partners to try to reach out with the same leaders of different communities, so we can share resources and we can share messages.
Thank you. So part of what I hear you saying is that the issue of resources isn't just an issue of the resources being available, it's also an issue of communicating effectively to communities how they can access those resources, whether that's social media or other groups. Johnny Corson.
Yeah, NAACP, what we have been trying to do as far as PPE is at all of our events, we try to provide masks. And as of late, we've been working with the homeless population, and we just donated hand sanitizer to hand out to the homeless population. So on the PPE aspect, we have a lot of generous members within our organization who are coming out their pockets to provide masks. We have provided masks to the Pottstown Hospital. We have provided masks to a assisted living facility right behind where I live at, and hand sanitizer. So that's all I can comment about as far as PPE.
Thank you. And that act, that step of providing that help, that concrete help, definitely builds trust for the conversation about vaccines and the safety of vaccines. So thank you very much for that.
You're welcome.
Holly, is there another question?
Yes, some of these questions we did cover. So one of the folks wants to make the point about multilingual materials being distributed to non-English speakers. So I just wanted to mention that. I know Nellie touched on a little bit of that. We've already talked about long-term side effects, and that answered that question.
Okay.
And one of the other questions here is there any evidence of the vaccine being an issue for people who have serious food allergies?
So let's have a 10-second answer to that question, either yes or no, or we don't know yet. Dr. Lorraine.
Yeah, so that would be mostly a no. We're seeing, there are allergic reactions and we're expecting to see them, but it's no higher than we've seen with any other vaccine. And it has no relationship to other types of allergies. So the shellfish allergy that we sometimes worry about with other things, there's no crossover.
Great. So let me take one more minute here. We're almost at time. And I want to offer the panelists, is there any point that any of you want to make that you haven't had the opportunity to make yet today? Just signal that you want to have the floor. Commissioner Arkush, please.
Yeah, so I think one point that maybe hasn't been made tonight is to just urge people to not believe what you're reading on different social media. There is so much incredibly wrong information on social media platforms. So I really urge you to talk to your healthcare provider that you trust if you have one, or the county's website. We have a whole COVID website. It's montco.org/COVID-19. And at the top of that page, there's a button that says vaccine information. If you click that, you'll see a page that has so many resources on it and links to credible, honest, fact-based information about this virus. We have links to handouts in different languages, Korean and Spanish, among others. So there are places to get credible information, and that's where people should be going to do their research. They should stay off of social media.
Thank you, Commissioner Arkush. And one last question for you, the question that was coming back, and we'll close with this, is what can we expect about availability of the vaccine to the best of your knowledge, just general timing, any guidance you can provide?
Well, I think by the beginning of February, we should be moving into that 1B, and then, sometime maybe late February, early March, that 1C category. In Montgomery County, we're talking about probably 150, 200,000 people that are in those categories. And then when we talk about the general population, I think we're really looking at the spring. What could change that timeline, though, is there's at least one other vaccine and possibly two that will be presenting their data to the Food and Drug Administration in early February. And if they're both approved, or even if one of them is approved, that would give us some additional options. So the problem is not that we can't give it. We have plenty of people ready to give it. We don't have anything to give. And so if we just had more vaccine, we could be a lot further down this road. We just literally don't have it. So we're hoping that we'll get more doses soon, and that maybe we'll have another vaccine or two to put into the mix to get some more doses out there. But for the general, like healthy, younger population, we're looking at late spring, maybe even early summer at the rate that we're going.
Got it. Very, very good. Thank you all so much. You're an outstanding panel today. We really appreciate you sharing your insights with the community. Thank you all to the participants today who sat in on this and listened in and learned and can now go help educate your friends and family and communities and patients. So thank you all for participation today. And be safe, be healthy, keep washing hands, keep wearing masks, and hopefully you feel like you've got the information to make a good decision about getting vaccinated. Thank you all so much.
Thanks, John. Thanks, everyone.
Thank you,
Yeah.
John.
Thank you.
Thank you.